Good afternoon, ladies and gentlemen. Welcome to everyone joining us from across Canada. My name is Shane Connolly. I am the chair of the Advocis School, hosted annually when there's not COVID, in typically Prince Edward Island. I want to welcome you all to the third edition of our Taste of the Schools webinar series. I will hand over the floor to our host and moderator, the one and only, Corey Collins. Corey.
All right, Shane, thanks very much. And ladies and gentlemen from across Canada, welcome to the Taste of the Schools. My name again is Corey Collins. I've been a member of Advocis now for the past 35 years, and this is our third webinar in the series over the past 7 months that Advocis has been holding. We've been doing this because of COVID and because we can't get together for the in-person meetings. And as an announcement that you may or may not have heard of to this point, we are not having any more schools, at least until 2022. So if you keep enjoying these presentations, please let us know, and we can keep putting these on for you. But it's great to see the popularity. It's great to see the interest. We have almost 500 people signed up for this afternoon. We also want to thank the sponsors. But again, Shane, thank you and thank your committee for organizing on behalf of the Advocis School for today's meeting. The topic today is underwriting. So with this format, we've gathered a number of questions from people across the country that we're going to bring to our panelists today. But if you have a question that you want us to ask, please feel free to type it in. Shane's going to be monitoring those during the meeting, and we'll try to fit some of those in. And the final piece of housekeeping is that for the CE credits, we will be having 2 polls during the webinar. You'll need to answer both polls electronically in order to qualify for your credits. So I am excited to get this moving today. It's all about underwriting, and when you learn about these speakers, these panelists, you'll understand why. Dr. Bruce Empringham graduated from medical school at Queen's University, and then he completed his family medicine residency at McMaster in Montreal. He practiced in North Bay, Ontario before he took on a position as the assistant medical director for London Life in 1991. His responsibility continued to increase over the years, and over the past 30 years that he's been with the company, he is now responsible for life and living benefits, medical underwriting, and medical claims assistant. So today, Dr. Empringham, or as we know him affectionately as Dr. Bruce, is active on large casework and with COVID-19 strategies. Romeo Vitagliano, he is the vice president of underwriting at PPI. And Romeo joined PPI in 2007 as the director of underwriting. Today, his mandate is to promote advanced underwriting as a cornerstone within the insurance sales practices around the country. He is the co-founder of Know the Risk, which is an underwriting resource now owned by PPI and contributed to by Romeo. Romeo has a BA from Concordia. He holds his FLMI, his FALU, and he also has a ACS designation. He's been extremely active in the different associations across the country on an executive and a membership level in several associations, including the Association of Home Office Underwriters, the Canadian Association of Underwriters, and the Home Life Underwriters Association, just to name a few. And our third panelist, Karen Cutler. Karen is the head of underwriting and claims for Manulife, and she's also the chief underwriter. Now, Karen oversees individual insurance underwriting and is responsible for life and living benefits and health and dental and travel insurance. She's been with Manulife for 15 years. She's implemented many leading industry developments like artificial intelligence underwriting, fluid-free accelerated underwriting, reduced evidence underwriting, and insuring people who are HIV positive. Now, at one time, Karen was chief underwriter for Swiss Re in Canada and the Caribbean, and Karen is currently the chair of the CLHIA Committee on Underwriting Issues. So, lady and gentlemen, welcome to the session.
Thank you.
Thank you.
But, you know, to start off with, maybe what I'd like to do is on a round table basis, and maybe Bruce, we'll start with you. Is there a comment, something on your mind that you want to throw out, or even is there a message that you just want to make sure that that you get across today?
Wow. Thanks for starting with me, Corey. I'm sure I owe you somehow. I have to tell you, my space has been so much taken lately with COVID that I would say to everybody, please continue to work this through, look after each other, and get your vaccines when they're available, and we'll get through this.
Okay.
That would be my message to start. There'll be underwriting stuff along the way, I promise.
Good start. Karen, how about you? Any message, what's on your mind, or any comment?
Yeah, I just build on what Bruce said. I mean, if you see the numbers across, well, I'm in Ontario, you see the numbers here, we just have to pay attention, and I know we're all tired of this, but just, we need to stay focused and get through this. It's not over yet, but you can see the light at the end of the tunnel, and get your vaccines.
Okay. Romeo, your turn.
Well, yeah, I obviously have to second that, having been the recipient of a vaccine recently myself, so well said. Karen, no, it's been an interesting time, Corey, and the last year has also been a time of reflection, and it's been a time of reinforcing the relationships we have with our advisors, our brokers, our clients. I don't think I've spoken to as many of us advisors in the past year, simply because I think the outreach is so natural, so reflexive, that it's actually on that level, it's been very gratifying. It sort of reinforces the importance of what we do and how much we need each other. So hopefully this dialogue will just continue in that vein.
Yeah, and we're finding that meetings like this and communication is making a huge difference with the advisors across the country. Yeah. Karen, if I could ask you, even just with the first question that I have here, COVID has changed all of our lives forever, and people say that there is no normal and we're not going to get back to the same state as what we were. But how has COVID influenced your job over the past year?
So it's a pretty loaded question. There's a couple of things that I would say. One, yeah, I agree. We've had the opportunity to build some deeper relationships because we're actually doing video calls, whereas in the past it was more phone conversations. And so what I love about this is when I do talk to people, I get to see faces that I don't necessarily see all the time. We get out and try to meet as many people, but that's been one huge opportunity. From the risk side, obviously, when this started, we had no idea what was going to happen. And what we saw initially was a bit of a pendulum swing to the, can we really manage risk, and can we find our way through selling insurance as the pandemic begins? So that was one of the issues that we had to tackle very early on and get really comfortable with. And, the rate of the pace of change is not something I've ever seen before, because the developments with regard to COVID, I mean, it was just happening daily, by the hour almost. And so trying to keep up with that was pretty tough. So, those things have definitely influenced, my day-to-day work. We kind of got sidetracked from all the great things that we were trying to do, some projects and everything. But on the other hand, what we did was, turn our attention to figuring out how best to service advisors and to make sure that we could, continue to sell our products using electronic methodology and everything, and really put the resources behind that. So the job has changed a little bit. I mean, these are all things that we would have intended to do. We're all closet epidemiologists. That's one of the things that we found out very early, is that there was a lot of specialists in our lives suddenly, and everybody had all the answers. And what we really needed to do was to go slow to go fast here. So what I'm proud to say is that I think, the industry as a whole has not overreacted to, from a risk perspective, to this particular virus. We got understanding early on how it was going to impact us, who the higher risk applicants were, and we managed our way through that pretty effectively. Were there mistakes and things that we could have done differently? Probably. But, when you're starting out on something like this where the end state is unknown, I'm pretty happy with, I think as an industry, we've done a very good job. I think we did a good job in reacting to customer issues. And from the claims perspective, I'll just speak to that for 1 minute. I got pulled into claims last January. Good time to start changing, getting a whole new team working with you is right at the beginning of a pandemic. So, a lot of stretching this year, and I think we certainly saw that among all the claims and underwriting teams, that people were stretched a little bit.
Perfect, good. And for those listening, we're going to be getting to the poll question. So if you want to get ready for that in a moment. But Dr. Bruce, the same question to you. How has COVID influenced your job?
Dramatically. It's hard for me because I moved from the full-time, sort of senior medical director at Canada to working directly with advisors only on jumbo cases. So my job changed because I changed my job. But for COVID, I would say the two things I've seen dramatically, and I would just add to Karen, thanks for raising claims, because there was the latest COVID hoax a couple of weeks ago now that if you die from your COVID vaccine, we won't pay a claim in the insurance industry in Canada, which is wrong on two counts. Number one is you're not going to die from the vaccine. Number two is if you did, yes, we'd pay the claim. So I think that's worth us addressing, just because it became this, like it was wild. I was getting like a dozen emails a day about that all of a sudden. Somebody picked up on this hoax. So just for anybody listening, yeah, claims are paid by companies if you died from the vaccine. Just that seems like a ridiculous thing to have to say out loud, as Romeo and Karen, I'm sure, agree. But anyway, we have to say it sometimes. For me, I would say the thing that I've noticed in COVID is that despite all of the stress and difficulties, and I don't for a minute take away the difficulties, people have lost people, addicts struggled when all the meetings closed, harder to get to doctors, the COVID collateral damage has been huge. And so I'm not minimizing that for a second, but what I would say is that there was an opportunity here as everybody got kicked in the knees. And Karen alluded and Romeo alluded to this already. It's a chance for the people who want to connect to really elevate themselves, right? When it's easy, everybody can do the job. When it gets difficult, we've seen some people really elevate their game, and it's been kind of gratifying to watch, and to watch clients now willing to have Zoom meetings about buying stuff they would have never had before. Mm-hmm. There's maybe opportunity here for people who can get up to the plate and take it. So that's the exciting upside to COVID for me, Corey.
Perfect. Romeo, your job is a little different, working not with an insurance company, but with PPI. And how has COVID influenced your job?
Almost the way smoke blowing into a room would permeate the room, Corey. And even if you've cleared it out, there's still a little bit of residue there. So it's become something more of something acute, less something acute, but something almost chronic. So in our day-to-day, there was an initial anxiety amongst our advisors. Are we going to do business? Are carriers going to shut down? You remember the suspension of paramedical services, which was a hurdle and obstacle that we all collectively had to deal with. So there was a lot of reassuring. I almost felt like a Dr. Bruce myself, more of a clinician in terms of providing not insurance, but reassurance in that sense. And our industry is strong. If we look back, I like to look at, they say that you learn from the backwards before you can move forwards, right? So, and say we've survived this, and we have, as Karen said, we've done overall very, very well. We see the sales figures, at least from my vantage point, are well. The large case market seems to have come back roaring as well, which is extremely encouraging. But the influence, Corey, in terms of COVID-19 is there. It's this cloud, sometimes darker than other days, but always seems to be hanging over a lot of the discussions, the retail discussions I have on certain cases. Again, as was mentioned earlier, we've identified the at-risk groups. If you put those numbers together, people who are obese, people who have chronic kidney disease, hypertensives, people who have suppressed immune systems, you're talking about millions and millions of Canadians, and by extension, millions of our clients or potential clients. So when I say it permeates, there's often a conversation there, and we look at what impact has it made as a whole, and on our case-by-case situation as well. So there's definitely an influence. Good question.
Oh, good. No, Bruce, you made a comment that you're proud of the way that people have moved and stepped to the plate and so on. Do you anticipate that some of these changes that have been made are going to be permanent?
Yeah, it's good. Well, it's not my problem anymore, Corey, because I'm now helping people get insurance. So now, instead of worrying about mortality, I hope they all stay long term. I would say the important thing for me to remember, Corey, and I know folks that have been in this game for a while know that we're not a sales industry. We are a claims payment industry. And the minute we forget that, we can run into trouble, right? So as a manufacturer, you have to remember your claims payer first. And I think the important thing to remember, and every company's worked so hard during this last year, is as limits have crept up, well, they didn't creep, I guess, they leapt. They were creeping, then they leapt this year. But as stuff has changed, the non-face-to-face, the digitalization, the signatures, all that stuff has happened, everybody's got to continue to keep their eye on the ball. And my main message to everybody would be that as those changes stay, field underwriting becomes, funny, we talk in the manufacturing side about making it easier to do business, but in fact, what we've done is laid stuff off to the advisor so that what you ask your client now really matters. So I think it's, as this goes forward, I hope a lot of the stuff changes because it stops a lot of requirements and things, right? That's a good thing. As long as people take the field underwriting piece seriously and continue to do good work on the front end.
Okay, perfect. Before we get to the next question, then it's time to do the poll. So Shane and Tim, if you could put that up on the screen. Just as a reminder, you must answer both poll questions in order to receive your CE credit. So there it is. I'll read it and answer yes or no.
There's a whole afternoon presentation and discussion in that question, Corey, for goodness sake.
Bruce, I didn't ask you to answer the question. All right, so take your time to go ahead and do that. Now, Karen, I'll ask you the same question that I asked Bruce. Do you see these, and do you agree, disagree with Bruce about things changing on a permanent basis?
Yeah, I do agree with Bruce. I think it's really important. What we saw early in this pandemic was the really forcing us to really rethink our business model. And I understand that this pushes, more work out, but I think the side of this is that what we're trying to do is also, through digitization, make the process a little bit more seamless for the customer. As far as, the underwriting changes, fluid levels, all that sort of stuff, absolutely, that stuff has to stay. We're at a point now where we understand the benefits, the cost benefit to doing all of these things. And we pushed ourselves a little bit harder at the beginning of the pandemic to be able to make sure that the products could be made available to our potential customers in a way that's safe. Now we're, when we have people in the healthcare industry who are out there potentially treating patients with COVID, we don't want them going into somebody's home, to draw blood and to do all that sort of thing. So, again, if we can test the right people and if we can get the right information on every policy, become a little bit more customized on how we do our underwriting, I think that that's a really important piece. And I'm glad to see that we did push ourselves hard on that. And that's certainly something that's got to stay.
Okay. Romeo, you have your finger on the pulse on that question, just talking to all the advisors. Do you think that clients are happy or upset with some of these changes?
We see clients who are happy to be more and more engaged. And just to pick up on both Karen's point and Bruce's point, Corey, Karen had mentioned that there were projects that were sort of put aside that we're coming back to that are client friendly, that I think are going to allow us to do better field underwriting. And that, I think, just by definition, ties in with some of these projects to do better underwriting, accelerated underwriting. So I think that's very, very much something on the table. And interestingly, in our own case, where we're looking at field underwriting initiatives all the time, some of that stuff got put on hold because of COVID. But I think that's just like taking the slingshot and just putting it back only to get a little bit more speed going forward. So I'm very much with what Bruce and Karen are suggesting. I think the necessity is there, and I think the impetus is even stronger. If we look at the last, well, we can argue there was a pandemic in 2009 for anybody that remembers H1N1, right? There were some warnings. There were imminent pandemic warnings even then. I think if you added that to your survey questions, there'd probably be very few of us that would raise our hands and say, oh yeah, I remember when Health Canada or the WHO issued that warning. Most of us don't, because it didn't pan out to be a big deal unless you are an epidemiologist, and I know Karen and Bruce and I were around in 2003 with SARS. And there was a lot of red flags going up then. There was another pandemic that was potentially coming, but that never happened at the same scale. So perhaps this is the game changer, and I very much agree. This is just going to keep us on a faster track.
Okay. Karen, going back to you to reverse direction here. Is there, with COVID, a lot of people are getting sick, but some people are dying, but not everybody. Is mortality being affected to the point that the insurance companies are concerned?
Yeah, COVID is interesting because for at least for the Canadian population, most of the deaths were in the 80 and 90-year-olds, and largely an institutionalized population, those in long-term care. I lost my own father in November to COVID. He was in a long-term care facility, so I lived that bit of a nightmare where you don't get to say goodbye and all of that sort of stuff. So that stuff was really real. I think from a population perspective, though, we are not necessarily seeing mortality that's strictly COVID related. What's interesting, if you look in 2020, there were, I think, somewhere in the range of 5% extra deaths in Canada, and not all of those are COVID related. And in fact, in the early part of the pandemic, a lot of that was cardiac related because, quite frankly, people weren't going to the hospital. They weren't calling 911. There was a general fear around that. And great article in the Globe and Mail this weekend just around what the impact is going to be of delayed cancer diagnosis and everything. So there's mortality coming, but it's not going to come necessarily from COVID or long COVID or those sorts of things. It really is going to come from the delays in medical treatment, not things that we're worried about at this time. Like, we're all looking at it and going, okay, what is that going to mean for our populations? But you've got population mortality and then insured mortality, which are generally different things. But having said that, we should expect to see, a little bit of wonkiness in mortality across Canada. Wonkiness being a technical actuarial term, across Canada for the next 5 years. So yeah, I think there's some issues there, but not, as I said, not something insurance companies are reacting to at all.
Well, first of all, I'm sorry to hear about your dad, but it also shows how it affects everybody. Mm-hmm. Bruce, the same question to you as far as mortality. What's your thought?
It's been, as Karen said, nary a blip from our point of view. And I guess I totally agree with what Karen said. I would only highlight the fact, because again, back to medical me, defending public health, trying to make these decisions, the poor folks, is that, there's going to be, I always weigh that what everybody's doing is, weighing COVID, the collateral damage from COVID versus what would happen from COVID. And I just point out that let's not criticize the shutdowns for the medical problems that happen in the future, because without them, we might have had so many COVID deaths. We had a different answer to the COVID death question.
Yes, that's true.
So I just focus everybody on the fact that it wasn't a bad thing to do what the country did. Okay.
Romeo, any thoughts and comments on that?
No, I can just add, I have seen some of the actuarial studies that suggest if we don't respond to COVID properly, then again, to build on Karen's point, that the mortality that's going to accrue over the next decade, I've seen projected as far out from delayed testing, screening, diagnosing, treating, etc., is going to be impactful to us, and that might dwarf any strict COVID related mortality. So it's definitely a yellow flag of concern for us to monitor, and we hope that we won't have to cross that bridge.
Yeah. Bruce, you may be surprised to hear the answer to this. The poll was 51% in favor of gender status should be asked. It's a sliding victory.
That's right.
There you go. Bruce, back to you then. Herd immunity. Is it? Do we have to wait too long for that? What's your thought? Is it going to make a big difference?
Me?
Yeah.
Yeah, we're right now running the risk of the variants, and what if they change the immunity level, and does that come back? And I suspect we're going to be into a long rumbling end and not the fine end we'd love for COVID, where it's like, man, we've had herd immunity, carry on. I think this is going to drag on. We may be into annual COVID shots if it continues to evolve. Remember, everybody, this is just a cold virus. We expect that it's going to mutate just like it is. Like, this is what had to happen. And so I think it's going to continue to change, and we're going to be stuck with it. Hopefully, once we were exposed to something like it before as it evolves, we're going to have some immunity, and it's not going to be as big a deal. That's our hope.
Okay.
I think herd immunity, we all hope that we get like 80% and we can all go over the heck we want, right? I think it's going to be a bit of a slow drag at the end.
Okay. Karen, anything to add to that?
No, I agree with Bruce. I think this is going to be with us for a while. And if you go back and look at, 1918 and the waves and everything that happened there, they didn't just stop. It carried on for a number of years, and there's pockets. So we should expect something similar here.
So Romeo, back to you on a different question. People are changing the way they do their work. Advisors, some are more motivated and some actually are quite less motivated because of the way they have to do things. Are you seeing more volume of business or less, or are people buying larger policies or smaller policies?
Well, I'm not sure I'm coming across too many advisors who are less motivated, Corey. That might be just the bias of my day-to-day work. In fact, in the last year, what I've seen is a renewed interest in advanced underwriting, a strengthened engagement, and I think there's an awareness. And again, I like Bruce has made that point very early on in the discussion, that field underwriting is the key. I mean, it's one of the reasons I do what I do, because I'm a believer in it. But I have seen a re-energized advisor force, especially in the high net worth market, that are even more curious and say, how can I get more involved in my cases? Obviously, I want them to go well and I want them to go faster. So if anything, one of the outcomes of COVID from my vantage point is like I said, a re-energized advisor group. Maybe it's an aberration, maybe it's not, but I'm betting that it's not. We're going to build on that.
Okay. And Bruce, a quick question on that. Are you seeing more volume or less volume?
Of actual cases, it's hard for me because my job is just growing, Corey. So corporately, we're really seeing things start to spin up, obviously. And in my role, people are starting to figure it out. So my volume's going up.
Okay. Karen?
Yeah, I mean, really healthy volumes and lots of interest. I mean, our field folks are incredibly busy. So, our numbers are good. And my underwriting team is starting to complain about the volume. So things are great.
That's a good problem.
Good problem.
That's
have,
right.
yeah.
I mean, that's normal, right? So it feels like this year feels like a normal year from a sales perspective. It absolutely does.
Yep.
It feels like a really busy year. So that's an amazing thing. And we do appreciate, the challenges that our advisors have. The advisors are having in out there trying to sell insurance in a non-face-to-face environment where you can't even see people in certain regions, right? So thanks for persevering through that, because it's going to be, I think we're going to have a great sales year across the industry.
Yeah, with the talk again on vaccines, and this question is out for anyone, but has there ever been any talk on rating people or having exclusions on policies if they don't get the vaccine?
So no, absolutely not. I think, what's really interesting about this is, we're all talking about this vaccine like it's the panacea, and we actually don't know that. This vaccine is important now to break the cycle. But Bruce just talked about the fact that we'll probably need boosters. We'll need annual vaccines, potentially. We don't know. But I think rating somebody if they don't get the vaccine is similar to rating someone who doesn't undergo a colonoscopy. There's risk, but we should be able to manage the risk based on all of the other factors involved in the case. We are baseline, a standard population, and then we go from there. But having a vaccine or not, really isn't going to be terribly telling unless somebody's got substantial comorbidities, and you can manage that through underwriting the comorbidities. Bruce, I don't know if you want to add anything there.
I think from an insurance point of view, you're probably right. I think practically we can't, start rating people because what about people who are allergic to something or
Right.
actually can't have it? Personally, I'd be okay if you're anti-vax with just not giving you coverage, but that's the medical me speaking, right? I just have no problem not covering you if you, for some reason, say vaccines are bad, right?
Yeah.
But that's a personal thing, and from an insurance point of view, Karen's dead on. It's of course we can manage the risk.
Okay. And we're getting the end of the COVID questions, but is there anything that the insurers can do to prepare for the next pandemic?
I think we did already when Romeo raised it. Romeo, thanks for raising that, because you forget, right? We had SARS, we were all on point in SARS. Yeah. HIV when it started, right? Insurance companies had to put away 2% of extra money into reserves for rising deaths. Then along came SARS, and then H1N1, which I'll point out, by the way, Romeo, thanks for raising that also, because that would have been a pandemic as bad as this one if it wasn't for what? The flu vaccine cut it off at the knees, right? So let's remember we were saved by a vaccine from a pandemic like this sometime.
Yeah, and if I remember,
I think Bruce, we've done a lot of work.
Yeah, I was just going to say, I think the H1N1, we had something like just over 400 deaths that year, which was significant, and we had none the next year. So that speaks to the effectiveness of the vaccination. So I think again we can learn from what we've already done. And to the larger point, I think as underwriters, we collect enough information on the whole, and there's the collective underwriting knowledge in Canada is very, very strong. So I think we should all be assured or reassured.
For sure. And the only thing I would add on that is operationally that we should all be writing down exactly what we did this time, because I think for each of the last ones, they didn't, SARS was fairly contained. H1N1 could have gone the other way had it not had the vaccine. But what we do have to realize here is, when our health system is really impacted, we're not going to have paramed nurses available. We're not going to have these availabilities, and so those are the things that we have to make sure we're prepared for in the future, and making sure we've got alternative processes in place and develop those now, because operationally that's where we were challenged through this at the beginning.
Yeah, here's something totally off topic then. Bill C7 in medical assistance in dying, or the MAID program, I believe it received some royal assent on March 17th. For anyone who buys a policy within the first 2 years and they elect the MAID program to assist their own death, is that considered to be suicide?
So, well, the answer is no. I mean, it's a medically assisted program. If people have to go through a vetting program in order to qualify, it's not something, you can just make the decision on. And in any death in the first 2 years, you're going to be looking at, okay, so what was the reason? What was the cause of death? What was leading that person towards that decision? I think the new changes have got I think a 24-month stay while the various ministers come up with different ways to implement this thing. But we'd also want to look at a death like that in the first 2 years. It can happen, especially with some of the cancers. But generally, we would look back to to see, did we have all the disclosures at the time we underwrote? And that's basically how we have to handle those cases.
Okay. Bruce, I see you nodding. You would agree with that?
Absolutely. I think the only thing I'd add is that the way I look at it is that the old law, as it were, in Canada was like that end of life. It was like, somebody was going to die of pancreas cancer next week and chose this week to be, when family was around, or for whatever reason, it was the right thing for them. Mm-hmm. I mean, I suppose if the law continues to slide, everybody's worried about a slippery slope in Canada. And, what happens if, right? When I'm 70, my kids decide it's time and put me on an ice floe and, decide it's the end for me. I mean, that's what everybody worries about, right? What happens about disabled people who, but that's a medical problem, not an insurance problem. You could imagine a scenario, and I think, Karen, you'd agree, that if this law continued to morph down, away from where it started to this one, to another bunch of iterations, you could get to a spot where it got complicated. Mm-hmm. But it's going to be so complicated for society before we get there. And again, it's just an area I think Advocis has to be heavily involved with governments and advisors at the grassroots level. This is a huge place. This is a bigger question for Advocis, Corey. You all have to stay engaged with the governments to make sure this law does the right thing, because you're a planning group for end of life. That's what you do. And I think you all need to stay involved to make sure the right decisions happen. The insurance issue is a non-issue relative to the rest of the issues we have.
Yeah.
Romeo, any comment?
No, other than the last time I actually saw Bruce was almost 2 years to the day. I could see he was a passionate advocate for for this topic, and his passion hasn't diminished. So I would defer to him on all things to do with medically assisted dying. But I agree. I mean, there's an epidemic of Alzheimer's disease and other end of life issues that I think that are going to overwhelm us at some point if we don't get our head around it.
Yeah. It's a good time in insurance for us to be very proud of how we act. I think that's a good point around the main loss.
Well said. Well said. So with the underwriting for disability applications, one of the questions is, are you working from home, or do you work at home too much, and how do we deal with that? Has that come up from an underwriting standpoint now that most people are working at home and trying to buy disability insurance? Karen, any comment?
Yeah, sure. So yeah, for sure. I mean, we've looked at that, right? Because the reality is, the big question is how many people are going to go back to the office full time when all of this is over. So I guess, yeah, we're absolutely looking at it, and we're taking, you have to take into account what's the occupation, what's the, what is the likelihood of people going back into an office. Like, if I think about my own situation or that of my underwriters, 70% of underwriters were already working from home anyway. So if they're buying disability insurance, they're able to do that just because simply they're working every day. So I think, our team has definitely looked at that, and they're, have to update all the guidelines. We've one of those cans we've been kicking down the road thinking we're going to be back sooner than we are, but on a case-by-case basis, they're managing through it now and, taking that fully into account.
Okay. Romeo?
Well, from my vantage in the field, vantage point in the field here, from Karen's lips to God's ears.
This is being recorded.
I hope so.
And Bruce, any final comment there?
I agree totally.
Okay,
You have to be careful, because working at home is a harder thing to it. The bigger problem, Corey, of course, is which Karen didn't say, is that the bigger problem here is it's harder to adjudicate the claim.
Oh, for sure.
When somebody's working from home, that's the issue. It's not whether you're working and it's harder to, it's not that your chair makes you sore, it's that it's harder to adjudicate. So. Okay.
Here's a question that always makes people hungry. Let's talk about marijuana. It was totally illegal. You couldn't do it before. People were rejected for it. You guys are much easier on it now. Will it ever become fine from an underwriting standpoint to smoke marijuana?
It already is, isn't it?
Yeah.
It's a lot better now than it was before.
So I think I've always said it's the risk has nothing to do with, we're not the morality police, right? So the fact that it's legal has a little bit to do with it, but smoking dope is still bad for you if you do too much of it. And so you're always going to have a problem, especially on disability, when you smoke a product that makes you not want to work every day. It's a problem, and it can, and we treat all kinds of people for marijuana addiction. Like, this is not an innocuous substance. And I think as long as we remember that, I think the insurance company, again, I'm now on the other side. You guys have done a great job, Karen, from getting the industry into the right spot. It's been really good the last year.
Yeah, I just want to build on that. Like, I think, I agree with you, Bruce, that, we underwrite people who drink alcohol daily. And we don't know the size of the wine glass. Bruce and I have had that conversation in the past, but I think the issue here is, are people functioning? Do they have other history? Are there bad driving records? Like, all of those things come together. It's a lifestyle choice. And that's what we have to look at is that lifestyle choice going to have an impact on the health and longevity of the applicant? And that's what we're looking at. What's interesting is you see the amount of disclosure has gone up substantially. It's not that our population has gone up substantially. The same people are still smoking that were smoking before. I think you've got a lot more people experimenting with it than openly experimenting with it than ever told us about that stuff before. So, it's been around for a long time, and it will be, and we're just going to manage through it. I think we've done a pretty good job of handling it, though.
Okay. Romeo, have you run into it in the field?
I have actually. When in a previous incarnation, when I sat in the chief's chair in the previous century, Corey, it started to research it, and even then, there was a good deal of evidence, at least the one I had come across, that suggested that there was very little excess mortality with marijuana usage within a certain corridor. You know, in the case that Bruce may have alluded to, like somebody who's smoking every day and is not motivated, can't work. That's a different fish. But on the other hand, if you have somebody who is professionally stable, socially stable, financially stable, doesn't have any health concerns, I'm not sure that we're actually not late to the party when it comes to underwriting marijuana usage. So obviously, when in 2016, if memory serves, that the majority of companies moved in that direction, I was quite gratified to see. And so I don't have as many words, because again, the benefit of underwriting being what it is, we can pick and choose those cases. So I think we're on the right track, and if anything, maybe a little late to that particular party.
Okay, good. How useful is a cover letter that an advisor might send in with an application? Do you see many of them, and what's their value, Karen?
Well, I think a cover letter is most useful where you've got either a large case or an unusual situation. You know, these two guys here who are in field underwriting, the importance of that, you know, that participation and the input is that the situation is unusual. I think on a clean case where you're really not expecting anything to go awry, one of the things you have to remember in our automated world is the minute you throw on a cover letter, it actually could take your case out of the automated process. Depends on the company, but it's certainly something that, you know, there may be a checkbox or something that prevents your case from going through if it's a clean case and there's a cover letter on it. Just think about that, you know, use your time wisely, all that sort of stuff. But I absolutely love to see a cover letter on a large case, and where, you know, if somebody's got a history with some chronic condition, or they've had a heart attack, they've had cancer, the things that we need to know are, how are they living today? You know, are they exercising? They're participating in you know, life in general. Have they, you know, how do they feel? That's a great question to ask a customer. You know, how are you feeling after you've been through X? Because that gives us a perspective. You know, the application itself is a two-dimensional perspective, a single dimension of the applicant. And what we're trying to build is that three-dimension view. So that's why it's so important to get those cover letters in those cases.
Romeo and Bruce, any other comment on that?
Well covered.
Okay.
Yeah, the only thing I would add to Karen's comments, and I agree with everything Karen has said, Corey, is that it still surprises me how many high-end advisors still think it's just enough to gather the evidence or have the client quote unquote examined and not themselves get engaged. So I don't really know what to put, and then, or I don't really know that much about the client until you actually start talking to the advisor, and they know a heck of a lot about the client's background, the account, everything. And there's a wealth of information that can't be shared on a one or two dimensional tool there. So part of my job is to coax and plead, and I'll beg, I have no pride, a cover letter every time that I can. So I think, yes, excellent. Thank you for bringing it up, and we can never emphasize it enough.
I would suggest, Romeo, that the cases you're involved in and the cases I'm involved in now probably all should have a cover letter.
Amen.
Yeah.
Amen, brother. Yeah.
Okay. One question just came in back on the vaccine, and Bruce, I'll ask you this because I think I know your answer. Which vaccine is the best?
The one they offer you. I think there's a great, you know, there's some great explanations. Efficacy rates are all over the map, but so much of that has to do with the prevalence in the population at the time the vaccine was studied. And so actually the efficacy rates are not nearly as different as they would look in the, if you know, when you look at the data. I think there is a reasonable concern that people are starting to have around AstraZeneca with the 1 in 100,000 risk of complications. But I want you to remember the risk is 1 in 100,000. And if you're a 60-year-old who lives in Toronto, your risk of COVID is way worse than 1 in 100,000. And if you're a 60-year-old who lives anywhere, your risk of COVID is way worse than 1 in 100,000. So the right vaccine is the vaccine you're offered. Let's get them in people's arms and let's get rid of this thing. I want to come out to the East Coast and see my family, Corey.
All right. Karen, let me ask you this question. social media and Facebook, is that used much in underwriting, or do you ever find things on social media that would lead to a decline that otherwise you might not know about?
So I'm not a fan of social media and Facebook. I think there's a lot of things out there that people put out about themselves personally. I always say Facebook is, a forum to make our lives look more interesting than they really are. Look where I was, look at what I did, that kind of stuff. It's my brag book for my grandchildren. That's my personal view on it. I just don't think that there's anything out there that is usable in any way, shape, or form. I think, you'd have to rely on, I wouldn't want to rely on any of that information, to use in underwriting at all. It's not credible. And you can get pictures from anywhere on the internet and throw them on your own Facebook of people parachuting, jumping out of planes, jumping off bridges, all that kind of stuff. Yeah, no, that may not even be the person. So I really discourage the teams from using that. I don't want to see it in any underwriting file at all. It's just not useful information. What is useful information? Google your clients, search your clients, find the articles, find the things that they've written, that they've published themselves. Those are the things that we're interested in. If there's some newspaper article written about them, the advisor should know about that before they submit the case. That Googling your client is the best way to understand what's out there about them. Facebook and the rest of it, no, it's not important.
Okay. Any comments, Romeo?
No, I couldn't agree more. I don't partake of social media. I don't think it has much value either. And as Karen said, but Google the client, because if you don't, we will in the work we do. And if we don't, the carrier or the reinsurer will as well. So good advanced underwriting is Googling your client.
I always thought advanced underwriting was the first one to get there.
That too.
So there's always going to be a need for the advisor. But with technology and reduced requirements and artificial intelligence and online applications, do you think consumers are going to want to deal direct in some cases? Karen, you with your work?
Yeah, I can take a stab, but I think it'd be good to hear Romeo and Bruce on this, because you're dealing with the high-end market all the time. I think advisors are an important part of our process. If I look at the difference between any direct consumer type of sale versus an advisor sale, the insurance company gets an awful lot out of that advisor relationship with the customer. And we can't underestimate that. There's always going to be a space for the do-it-yourselfers. We need to figure that out. But those people are also looking for a quick solution that isn't a long-term or even a short-term plan. So there's some portion of the population that likes to do things themselves, but the majority of people need help in this world. It's a complex process, and if you want to get the right protection, you want to get the right coverage, you need to have somebody walk you through that. You can do a lot of things on your own, but it's not always advisable, and so having advice is, I think, a big part of our process that needs to continue.
I'm just going to add the old guy view, which is I totally agree, right? I've said that forever. The question, though, is all my kids are young professionals who think they want to do everything on their own. And as an industry, we're going to have to figure out over time, like, how do we service them as a manufacturer and get them to advisors when they need the right connections? And it's complicated going forward, because my kids don't even think they'll ever have a financial planner. They do everything on Wealth Simple, and they think that's perfect. And no matter how many times I tell them that's dumb, right? So there's going to be a group of people. We're going to have to figure that out. That's an Advocis issue.
Yeah.
Okay. And before the poll, Romeo, any comment there?
Well, I'm reminded of a discussion I had with one of Bruce's colleagues as a medical director, who I know is a friend, and his son said, I have to pee into what to get insurance, and you're going to stick me with what? And he says, there's no way. And when he got a little older and he got married and he had one or two children, then I remember getting a call saying, you know what, I'm not sure what the best coverage is here. And well, what do you want to do? And well, I'm not sure. And he says, you need an advisor. So I think with age comes that wisdom. So I'm all in on this is an advice-based relationship. business. Now, again, Karen made an excellent point. Maybe we need to carve out a niche for the pure transactionists, who are interested. But I think by and large, I don't think in our lifetimes we're going to see the advisor go anywhere.
I hope you're right, Romeo.
Yeah.
I've heard a comment that I'll repeat that says that artificial intelligence will not take over the place of advisors, but advisors who use artificial intelligence will take over those who don't.
It's a great quote.
Yeah, it's great. Yeah.
So let's bring up the poll question, Shane and Tim, if you could pop that up on the screen. Do you see yourself continuing to work from home following the pandemic? So if you want to answer that question and submit your answers, we'll get on to the final questions here. And we do want to end on time, so we just have a few moments left. Good. Romeo, I'll ask you, what do you see as the key items facing the insurance industry into the next 5 years or so?
I guess to answer that best, Corey, I'm going to look back as an optimist. So, Karen mentioned the 1918 pandemic, right, which was devastating. But if I look right around the corner there, while that was going on, you had Dr. Bantine, who was isolating insulin, and to the point where they were able to inject insulin into a little boy's, 14-year-old arms just a few years later after the pandemic ended. And we were able then to insure diabetics afterwards. And then there was the whole polio epidemic, and the March of Dimes was founded, and there was the Salk vaccine that came out in the 50s, et cetera, et cetera. And even with HIV, again, I think Bruce mentioned it earlier, we don't have a vaccine, but we have these wonderful, what they call it, these antiretrovirals that are tremendously effective. If you think of Magic Johnson, if you're a basketball fan. So all that to say, and again, if we talk about vaccine, Bruce or Karen might correct me if my numbers are off, but I think the previously fastest developed vaccine was the Ebola virus vaccine, which took about 4 years, and the COVID-19 took 326 days. So I'm very optimistic that whatever we need to be doing, either as an industry or even in clinical medicine more broadly, is already taking place. So we're going to look at new risk factors, things like step count. Manulife does a great job in acknowledging just sheer physical activity. So I'm not sure specifically, Corey, but I know that a lot of that's already in place already. So I think I'll just have to sort of let that one stand.
Okay. I'm going to give each one of you, Karen and Bruce, 1 minute to answer that same question. Bruce, maybe with you first.
For me, I think medically we're probably reaching max lifespan. I think we're living to be an average of mid-80s, with 100 is sort of the top end. So everybody sort of gets to be 85, and it's like lemmings off a cliff compared to in the in the days as we evolve stuff. And I hope we continue to do it, because I'm near 60. So I hope we continue to extend that, Romeo. For me, the biggest thing actually is going to be the next 5 or 10 years is going to be as amounts of insurance up to millions of dollars get commoditized. It's, which advisor, which company, which manufacturer, which MGA, whatever, can figure out the way to enter into the market and dominate in places where service, where product, where everything matters more than where it's commoditized. And so I think that's going to be the differentiator.
Good. And Karen, before I allow you to answer that question, one quick question came in here. It says that this person says that they've never heard about HIV-infected people possibly getting coverage. Can you make a quick comment on that first before you answer the 5-year?
Sure. So we started that in 2016. So people who are HIV positive on the antiretrovirals and are, either marginally or almost completely undetectable are insurable. Now, we rate them similar to the ratings we put on type 1 diabetics, something in that range. And, even there, we continue to update our guidelines on that. So, yeah, if you've got cases like that, the industry is there. We're doing this now. For the most part, I think most carriers are doing it, and if you've got one that doesn't, try another. But for sure, we're all open to that business.
Okay.
Again, that's just the evolution of what we're doing here. So, And just on the balance, the rest of the question, just building on what Bruce said, I think it's all going to be about, how we can do this better, faster, cheaper. And I agree that we've got to, have the right service levels, the right incentives to get our applicants interested and to make it easier for our advisors to get this stuff across the finish line. And really simplify the processes for the customers, because the idea of peeing into a cup to buy insurance doesn't really equate with the younger generation that are out there. But if we can make it easier for them, then it's not if we build it, they will come. If we build an easier process, we can make it easier for our advisors to sell. So that's got to be the main objective here.
All right. Well, on behalf of the people who've been watching this event, I appreciate your time. I appreciate your intelligence and your answering of all the questions. So thank you very much. Great to get to know each one of you a little bit better. Thanks for being here.
Yep. Thank you.
And thank you, folks from the Atlantic School. Really appreciate it. The Advocis Schools, thanks so much for being a part of today.